might get started. Welcome everyone to our 12th webinar series in this Pacific Digital Health webinar series. This is actually going to be our last one for the year, but we will be reconvening next year. The Pacific Digital Health webinar series is supported by DFAT's Global Health Division, so I just want to say thank you to them for supporting this. If you do have any questions throughout this webinar, please pop them in the chat and we'll see if we can get to them at the end. This month we're doing something a little bit different and we're going to have a panel discussion with some very interesting people that we have on the call with us today. So without further ado, I'm going to introduce our speakers that we have on for this presentation. So the first one we have is Dhanya. So Dhanya is going to be sort of hosting our panel and taking us through the conversation. Dhanya is the operations lead of the mSupply Foundation with over 8 years of experience in digital health space. In that time, she's managed mSupply implementations and has a proven track record of project management and software management throughout the Pacific, Asia and Africa region. The other panelists that we've got is we have Lenara Tupa'i-Fui. Lenara is a Pacific Island ICT and digital health consultant who works at the crossroads of technology and people, making sure that digital health tools are useful and accessible for everyone. She's driven by the belief that innovation should bring communities closer together, not leave anyone behind. The other person we have is, I'll introduce Alex. So Alexandro Naisara. Alex serves and leads the Goods Monitoring Unit at the Fiji Pharmaceutical and Biomedical Services Centre under the Fiji Ministry of Health and Medical Services. So Alex has been a key figure in the transformation of Fiji's health supply chain from paper-based systems to a fully digital platform that spans across all public health facilities and warehouses. Alex's leadership has been instrumental in ensuring that mSupply is not only operational but also sustainably embedded within the Ministry of Health's workflows. So yeah, everybody welcome our panelists for today. We're going to have a bit of an open discussion and get to know everyone and the work that they're doing, and also sort of pick their brains on how to implement digital health tools, which I'm really excited about. So I might hand over to Dhanya then to start the conversation.
Kia ora, Pula, Ali, Talapulava. What a great panel we have ahead of us. I'm so excited to talk to all of these panelists who have such a wealth of experience in the digital health space. But before we get on to the more serious questions, well, first, I'd love for each speaker to introduce themselves. So first we'll hand over to, I can see Alex on our screen. So Alex, would you like to introduce yourself and your background in implementing digital health projects?
Good evening, everyone, and thank you very much, Georgia, for that introduction. I'm not sure how I feel about it, but after hearing that short introduction, I think my colleagues are going to expect me to suddenly start speaking in complete paragraphs and wearing a tie every day. But no, but my name is Alexandro Naisara to the others. I'm the principal inventory controller for Fiji's Ministry of Health and Medical Services. So in my role in digital health, it's not just a theoretical concept, but it's the core engine of our operation. I deal with the harsh realities of implementation, from managing the high financial risk of the supply chain here in Fiji, trying to battling the human challenge of data compliance as well. So I look forward to discussing how strong governance and data accountability here for Fiji in terms of digital health, and how the systems like mSupply are the only way move forward for sustainable digital transformation in the Pacific. Yeah.
Thank you, Alex. We'll pass over to Lenara. Lenara, could you please give us a quick introduction?
Talofa from Samoa. I think Georgia has already done the introduction, so I don't want to take up any more time, if that's okay.
Fantastic. Thank you, Lenara. In that case, before we get on to the serious questions, we're going to have a little bit of fun. We're going to play a quick fire game where we want participants to answer one or the other. And we'll just have you, both of you, yell out at the same time. So our audience has already started responding to these. So are you ready? First question is iPhone or Android? So if you two just unmute and let us know.
Android.
Android.
Me too. Okay, we're all in agreement there. Let's see what the audience says. Oh, okay. A little bit of an iPhone bias in the audience, but I think we've got a good Android.
It's Android for the Pacific.
All right, next question. And remember, just feel free to yell it out. Early morning emails or late night catch-ups?
Late night catch-ups.
Both.
Both. Okay. Well, I think the audience is a bit more on my side here. I'm not a good person at night, so I'm very impressed that you both are. All right, next one. This one's very relevant. Trial and error or meticulously planned rollouts?
Trial and error.
Trial and error.
Very nice. Oh, yes. Everyone, most people are going for trial and error, though I can see that there's a few who want meticulously planned rollouts as well. All right. This is a particularly tricky one, this next one. So going live with no internet or no power?
Going
Rapid
live.
fire, you two.
I'd have to
No
be
power.
mentally unstable to go without a phone.
Okay. Let's see. Oh, big preference for no internet over no power here. All right, the last one, also controversial. Tupa'i t-shirt needs a redesign or is it a classic?
Maybe some brighter colors.
What about you,
Classic.
Alex? Oh, okay.
I like the t-shirt.
Kind of 50.
It's perfect for me.
Wow. I'm glad we're partly there to deciding whether the Tupa'i t-shirt is perfect or not. I think we're ready to go on to some of our questions. All right. So you both work at different parts in the digital health ecosystem. Alex, you've been deep in supply chain in the warehouse space, and Lenara, you're working across that broader IoT and digital health space. So I'd first like to know, how did you end up in your current role, and what surprised you most about the work? We'll start with Lenara here, because I can see she's uninterested.
How I ended up in the work. Well, and I think growing up, I grew up in an era where we didn't have computers at home, no laptops, even in school. Our ratio of student to computer was 4 students to 1 computer. So I finished college never touching a computer. And then university, there were only 2 majors. I got a scholarship to study computing here in Samoa. Our national university only had 2 majors, a major in computing and a major in maths. I'm not really a maths fan, so I took up computing not by choice, but took it, loved it. Both my parents do not like computing, so I had to try and explain to them what computing is like in very simplified, in easy language. So I ended up taking up a liking to computing. Here in the Pacific, core issues are usually to do with health, education, or with the environment. So I studied computing in those three sectors. And then after graduating in 2005 and 15, I worked in health, and that's where my journey in digital health started in 2015 when I worked for for Ministry of Health Samoa.
Thank you, Lenara.
Yep.
That was very lucky for Samoa that you didn't like maths. Alex, how about you? How did you end up in your current role, and what surprised you most about the work?
So for me, I'm I'm actually a tourism student. Yeah, I'm a hotelier. My profession is a hotelier. But growing up, my dream job was actually to become a doctor. Become a doctor. So while working in the tourism industry, I went to USP and I thought a bit about tourism, and then COVID happened. When COVID happened, that is when I realized, the importance of being on the front lines. I I could not be a doctor, but I wanted to be in the front lines, directly saving lives. So that's when I actually moved to the Ministry of Health. While I didn't become a clinician, I actually realized, that saving lives it's not just about diagnosis or just by treatment, but it's also fundamentally about supply, and that's what I learned here at FPBS. You cannot treat a patient if the medicine isn't on the shelf. So that's how I found my way into digital health through the supply chain here at FPBS, and that's when I got introduced to systems like mSupply. And through the introduction of mSupply, it actually opened my mind on on digital health, and it even allowed me to assisted me for me to be able to check over 17 million, 60 million worth of medical items, and ensuring that the right medication and the right medicine is at the right clinic at the right time. So even though I'm not a doctor, no, I'm not saving one life at a time, but I'm helping secure the system that actually save thousands. I have two brothers who are actually doctors, so we always have a debate. No, and they are surgeons, but I always tell them, no, without the job that I do, no, they won't be able to perform surgery. So it was a really nice journey for me.
I'd hate to be your parents trying to break up those arguments, but it's such a great point that there's so many facets to how medicines get to patients and we manage to have these life-saving outcomes. There's so many steps on that journey. Now, the next question, I want to address something that you two probably both address quite a lot. There's so many misconceptions about digital health, but what's one misconception about digital health and what you do that you'd like to hear clear up? Maybe we'll start with Alex this time.
Yeah. So for us here at the FPBS, I think the biggest misconception is that digital health is purely a patient-facing clinical tool. No, people think that it means that it's an electric health record at the bedside. But from my experience, in reality, our most critical digital health tools are back-end logistics systems. This is from my background. Like for us, it's mSupply, which is the supply chain management system. Like if this system fails, or if our team does not accurately manage, the value of outstanding medical items, especially the 90 million budget that we have here at FPBS, then the clinical system will fail. That's one of the misconceptions. Digital health is a supply chain and data function as much as it is a clinical one, and that's what we're trying to from my office. We try to work closely with the clinicians and to let them understand that as well.
Great point. And Lenara, how about you?
For me, one of the misconceptions that I've encountered is people think digital health is a technology project to be led by ICT people, but we find that digital health is just a tool. You can buy the most expensive system, buy the most sophisticated tools, but if the users that are supposed to be using the system do not like them or will just shelve them, then there's no use. Hence why it's very important that we bring the users in the forefront and the technology people support from the back. For example, with Alex's case, when implementing a warehouse system, usually people will complain that ICT is not there. They're supposed to be there leading. But one of the things that we really want to push for digital health is the users taking ownership of the system and really understanding how the system will help with the workflow, and that will affect the service that they provide. So the users are very important, and their views are very critical to implementing a digital health system. Thank you.
Thanks, Lenara. That connects really well to something I want to explore a bit more. But just quickly, I want to give a reminder to everyone listening in that if you do have questions for our wonderful panelists, please feel free to write it in the comments, and we'll try and see if we can make time for that as well. And same for you, Alex and Lenara, if you have questions for each other, always feel free. But to carry on from what Lenara was saying, it's such a wonderful point because Lenara, I know in your bio you talk about making sure that digital tools don't leave anyone behind. I'd like to hear from both of you how you ensure that end users actually adopt new systems, especially when they're coming from paper-based systems and there might be a desire to revert to the old system. So perhaps we start with Lenara there.
So making use of the whole team. Usually, it will be a senior nurse or a senior doctor responsible for a clinical department, responsible for looking after a rural district hospital. So here in the Pacific, we also, well, here in Samoa, we have saying that if you want something, it's not how much you know and how smart you are, it's about who you know. And I think with implementing digital systems, you really need to build the relationship with the users and the staff, and trying to push new ideas to people who've been doing the same thing manually for so many years can be difficult. But once you get the senior doctor and the senior nurse to see the impact that the new system will have in digitizing work that they've already been doing manually, and seeing the reportings that come out of it, then the influence will also flow to the staff, the senior and the other junior staff coming on board. So really building those relationships will ensure them using the system is not just an additional or a burden or an add-on, but just a tool that's going to really ease the work that they are already doing, but provide better and more sophisticated reportings and results after.
Yeah, Lenara. And Alex, does that resonate for you? I know you were highly involved in the mSupply rollout and scale-out.
Sorry, Dhanya. Sorry, can you just repeat that question? Sorry, I had some issues.
Yeah, happy to. This is digital tech. There's always something going on. So I know that you've been strongly involved in implementing mSupply throughout Fiji. And one of the big things that come up is that digital tools can often be difficult for people to take on. There's a sense of reverting back to the old system or wanting to use the paper system. What are the tactics or what have you found helps to bring people along on that journey?
So thank you for the question. Like for me, as my department is the monitoring department, it's a bit difficult, and I think I feel that it's uh, one of my biggest fail as well in the rolling out of the digital health solution is like was underestimating the organizational discipline required for data entry. As a monitoring department, early in the rollout, we had staff at various health facilities entering consumption, transactions. It can be 1 month to 2 months after the items were used. This is just an example. Like, so our processing team was then making decisions based on old irrelevant data. So this not only corrupted our replenishment forecast, but directly contributed to the current issue where we have around nearly 390 delayed purchase order lines. So the lesson was the technology does not solve the human problem. So we had to attack this digital health rollout is by working with adaptive solutions. Working with the people, we had to backtrack and enforce a strict 24-hour compliance rule and relentlessly communicate. That late data is a bad data. So for us, it came right from our leadership, from our permanent secretary. He wrote an internal circular to try to ensure that all the health facilities, no, it's from the ministry level, are supposed to use mSupply. So that was one way of we were able to control, because when we were trying to monitor from FPBS and ensuring that health facilities are adapting to the changes, it was a bit difficult for us to start even with FPBS. Like Michael mentioned during the digital forum, is that we have some white ants that find it hard to actually change. I had to encounter here at FPBS that there's a need to change. We had put out a memo and internal circular, the SOP, and ensure that to let everybody know that now it's the focus of the ministry. Is everybody is supposed to be using mSupply. And I think that the top-bottom approach was controls and support from the leadership on top, and ensured um, acceptance from people in the health facilities, the staff from the health facilities.
And I know you also did, in addition from that buy-in from the leadership and having that, you've also done lots of weekly check-ins and really engaging the staff as well. Then.
Yes, of course. Like we've always explained, that the system, the system is a perfect system. The system is only as good as the people. We need to keep that interaction going. I have my team members always visiting the health facilities, explaining to them on how mSupply works and how this data is very important for us, especially for decision making. There's some things that they cannot see is what mSupply would be able to provide for them, and the reports that we are able to get from mSupply, we share it with them, and it actually gives them some more ideas to assist them, especially in decision making. Yeah.
I think you're both picking up on some similar threads here, making sure that the key people have bought in and then bringing everyone else along for that ride as well.
Yes, yeah.
Well, we've had some nice questions, but I do have a tricky one for you. So we all know that not everything goes perfectly, especially when pioneering a new system. I'd like to know, what is the biggest fail you've had in rolling out a digital health solution? And most importantly, what did you learn from it? Does anyone feel brave and want to go first? Otherwise, I'm going to have to choose.
I think Lenara should start.
Fail. I think the only fail I could think of is trying too hard and then losing track of taking care of myself. Oh, fails. I think the only fail I could think of was implementing the system during a what do you call it? An outbreak, during an outbreak. And then just as before we were to go out, we ran a backup that early morning. Yeah, so we ran a backup and then the system just went haywire. There were all sorts of issues. And I think right after doing that the first time, we never did it again. So the lesson learned that don't run backups or don't do any other server work when you're going to go live for any outbreaks or any mass national health implementation.
That's a big one, alongside never starting something on a Friday, because then you don't know what's going to happen over the weekend. Thank you, Lenara. And I think it's so important to remember to take care of yourself and your team as well. Thank you for mentioning that. Alex, how about you?
Yeah. I think so this is actually not a technical one, but I think for my department, one of the biggest fail was a procedural and governance failure. It's actually not a technical one. So like we actually successfully implemented mSupply. It's been running for the past 3 years, but we failed to recognize the power of long-standing manual habits that's still happening, that we're trying to change. So the failure was not creating a clear mandatory stores process manual. FPS did not have that before the system rollout. In fact, an audit later noticed that a manual was needed to guide the pharmacist and the warehouse staff across all locations. So the result was that instead of replacing the process, the staff created a parallel system. They ran the digital inventory in mSupply, but also kept a manual paper ledger on the side because they trusted the paper more. So this actually, created a double entry, as well as staff actually wasted time entering every single transaction twice, leading to burnout. There was a bit of a data inconsistency happening as well. So when the paper ledger um, no, I'm sure you would know this. I know that we were not using. We were using. We're no longer using the bin cards, the stock cards. Yeah. So when the paper ledger and the digital system disagreed due to a simple transaction error, the staff would always default to the paper. Will always default to the stock cards, causing stock errors, and inaccurate reports for FPBS. So I think the critical lesson that we actually learned was that you cannot install a digital system and expect manual habits to disappear. And we thought that we must first develop and first enforce the governance first. The governance and a single source of truth that makes the paper process officially no illegal, and that's why we went right to the permanent secretary to write an internal circular to ensure that there will be no stock cards. People should be using mSupply. So the biggest threat to our digital implementation was the continued existence of this manual comfort blanket, especially for us here in Fiji.
I love that phrase of a manual comfort blanket. I think that's exactly it. And such a good point, like a reminder always that digital projects are change management projects, right?
Yeah.
There's such a exactly as manual feels as a backup, but how do we get people to understand that the system can create that backup for you
Yeah.
and bring that trust forward? It's a big project. And that is why, in many instances for digital health systems, we do often start with the pilot. We've seen that, and I'd like to know what you both think about the idea of starting with the pilot, and that way of going about a scale out. And from that, what do you think makes a successful scale up from a pilot to national implementations? What are the factors that help us get there? Perhaps we can start with Lenara here. I know you both have lots of experience in this.
Yeah, I fully do support starting up with the pilot. Firstly, because it doesn't take up it takes up less resources, and usually there'll be tons of lessons learned from that. Other things you've never thought of, things that are not technical but people issues or process issues, financial. All sorts of things. So starting up with the pilot will allow you to know what not to do next time and what to modify and change so you can improve and do better when you do a mass implementation. For me, the biggest lesson with implementing a successful digital health was really people taking ownership of the whole process. When people understand and are confident with using the system, it's not no more about you going, okay, do this and that, checking up on them every day. You did not enter your data. You have a blank field on this. You entered wrong information. But it's more of them feeling confident of using the system and then getting back to you. And then you can scale and improve on that, because now when they take ownership of the system, you spend more time then looking at how to improve the system, improve the reportings, or this is something that needs to be upgraded, instead of remaining on the issues of staff. The nurses here are not entering data, and then it becomes repetitive. They get frustrated, you get frustrated, and we don't go forward. So really, for me, a successful implementation is when the health staff, not just the doctors and the nurses, but also the laboratory, everyone that's involved with the care of a patient, when they come to a crossroad of they wanting to know something, they'll say, oh, check on our system. Our system has this information. So for me, that's a successful implementation. Thank you.
I just want to check, are there any questions in the chat? I'm not seeing any at the moment, but all right. Well, I do want to know, we know that digital health implementations require many roles. We've got trainers, we've got IT support, project managers, champions within the teams. So based on your experience, what is the biggest gap in roles that you're seeing in the Pacific right now? And how are you working around it? You can start with Lenara here.
maybe I'll be a little bit biased, but for me, I think data analysis for me is one of the biggest gap that we have. We have M&E people for policy decision making. We really need to be people that can analyze the data. After working in health for more than 10 years, I find that we're collecting so much information and it's sitting separately in somebody's Excel sheet or on somebody's laptop. But having the right people to pull together all that information, for example, on dashboards, analyzing that information in such a way that makes it easy for non-technical people, for example, the minister or the CEO, for them to understand what the status of health is in a particular country is very important. And I think that's one of the things we're really trying to push is for more people to go into the data analysis side, or maybe more, if you're a data analyst outside of health, for more people, data analysts to come into health. Yeah, I think that's one of the shortages that we're seeing.
I actually know that Alex and the Fiji team have done quite a bit with their dashboards throughout the warehouse.
Yeah.
I'd like to know, Alex, do you also see that as one of the key gaps that in the Pacific right now, and are there any others that you see?
Yes, I totally agree with no, Lenara, that is the biggest gap in terms of data analysis capacity. But also one of the gaps is dedicated no, change management. People to be able uh, um, to bring up change in digital health. Like we need people that are skilled in clinical change management to be able who can go into any hospital or a lab department and actually understand their current workflow and actually guide them to the new process and ensuring that they enter transactions on time. And that's one thing that we that we try to work on from my goods monitoring department. For example, for my team, we are very good in um, in analyzing data. We have all these reports, all these graphs. That we have the dashboards that is there, but um, the next phase of trying to do now is what we're going to do with that data. So that's where dedicated change management to come. At the moment, there's only two of us in my department for us here. We are trying to monitor the whole of Fiji. We have put out a vacancy for an extra 5, and this extra 5 we've put in the job description has clinical change management team who, like I've mentioned, they understand we're getting nurses, we're getting pharmacists as well to guide them through the process because in majority of our health facilities is actually a nursing station. So if a person coming from a nursing background knows talking to a nurse in a health facility, they are speaking at a same language and they understand each other and they would be able to implement this change. Yeah. So I think yeah, clinical change management that skill is also needed for us here at FPBS.
Thank you both. I do want to say I've been lucky enough to watch both of you do your work across some of these national implementations, and it's wonderful to see what you've achieved. So, if someone on this call is about to embark on a new implementation of a digital health tool, whether that's in a hospital, supply chain, what's your most important piece of advice for them? We can start with Alex.
My advice is uh, I think my advice is focused. Yeah, need to be obsessed over the data and not to design, not the design. Yeah, specifically, need to establish a single source of truth for all data using one system, and actually to build a dashboard for every end user. For us here in Fiji, we are actually using two systems in terms of supply chain. We have mSupply, and then we have another system that is being used by our Ministry of Finance, which is BISAN, and that is for payments. We are working with the BS team. We want these two systems to actually integrate. So we only use one single truth for data. So if a facility has to call you to ask, where is my order, or no, or you have failed, or you can give them the dashboard, empower them to monitor their own requisitions, and only then they will feel ownership over the data that they enter.
Thank you, Alex. And Lenara.
For me, I think my advice would be to influence your CEO or your minister, because sometimes when you push and it's not, the support is not coming from the top level, you'll have a really hard time selling your idea. But if you really are able to influence the top level, and also I know a lot of the doctors nowadays are very much after data and health information. Majority of the health professionals really. So if you can get a couple of champions from the health side, the clinical side, that can really support you, influence your minister, and then influence your CEO, then that's a good start for you. And keep going. Usually implementations of health information system, nobody cares about health information or data until they reach a stage where they want to know what's happening, and they're stuck, they need to move forward, but can't make a decision because they've got no data. That's when they start thinking about data and health information. So if you are thinking about it, it already means that you are starting your journey. So just keep going, and there's help. I'm more than willing to volunteer to help with your planning. And also there's a lot of only when I after working in the public sector for more than 10 years, I was usually just, Google was my best friend, doing a lot of research on my own. Just a few colleagues here and there I meet in networking meetings. But being in the private sector, I started finding that there's quite a lot of other regional clinicians or nurses out there that are interested in improving health information and data. So reach out. Now with LinkedIn, there's quite a lot of colleagues on LinkedIn you can connect with. Don't be shy, and always willing to help or lend a helping hand with your journey. That for me,
Thank you,
that's it.
Lenara. And very kind of you to offer your assistance. For those of you who don't know, Lenara has done some great south to south work between countries, and I know visiting Fiji as well, and sharing that knowledge. I can see that there's a couple of comments in the chat. Um, there's one that from Susan Rackstraw, who has said, Lenara has identified a key issue for GOK-MHMS, where we do not yet have a policy and planning unit, including an M&E officer, established, and so all expectations are directed to the Health Information Unit, which is not responsible for this analysis. As a result, we don't analyze and present information in targeted briefing notes, such as those that inform decision-making at PM and executive levels. Lenara, did you want to comment on that at all? I think it was also just a comment. So if not, we can. Yes, this is from the government of Kiribati. Jeff says, I have a question for Dhanya. I'm not a panelist, but we can do 2 minutes max. mSupply is moving towards open source tools. Why is that? What are the benefits of open source and what is the philosophy behind it? So yes, indeed, mSupply is moving towards open source. And one of the key influences behind that decision is really thinking about ownership and governance of software. We are very interested in the idea of governments owning their own software and having that. Oh, sorry. Let me just see. Apologies. I think my video just stopped and I couldn't see any of you, which was a shame. Yes, so for open source, we are very interested in making sure that countries have that ownership of governance. And we can see that the Pacific is really adopting open source tools in a way that leapfrogs over many other countries throughout the world. And this is both something to be very proud of and to be very, to think through how you want to implement open source and how you want to bring it on board for your country. Because I know that's a discussion that you all will be happening throughout. There are great benefits to open source, not just in the cost necessarily, but more thinking about what it looks like to have a sustainable system that you can manage within the country and have for a long-term solution. So we also have a question from Gigi. Alex, you said you come from a tourism background. What similarities do you see between tourism and healthcare and supply chain?
Yeah, so um, it's a bit of a different. You have the tourism industry, and then you have the health, the health industry. But what links these together is supply chain in terms of inventory management. So now I'm with the Ministry of Health. I'm monitoring morphine while in the hotel. I'm monitoring a bottle of rum. So it's but yeah, it's inventory management and the supply chain. The principles are the same, but the products are a bit different. But my experience from the hotel here, because it's actually a corporate, it's a private company, and then coming to the health, to the government, to the public service. It has actually helped me to be vigilant as well in what I do, coming from a tourism and customer service experience, to be diligent and ensure that we have efficiency in our process, and how to to implement these digital tools, using my tourism skills as a people's person, and I talk a lot, but people like working working and enjoy working with me, because I'm always there to assist, and that's from my hotel background. Yeah.
Thank you, Alex. I think.
Dhanya, if allowed, maybe I can answer to, I just read Susan's comments.
Yes, that would be great.
Yeah. So I think this issue is also, I think it happens in other smaller Pacific islands as well, similar to Samoa, where when we're developing the dashboards, people, every time we invite either policy or M&E people, they don't turn up. Everyone thinks designing dashboards is specific for health information or ICT people. But really, one of the things that we push is the policy people and also those involved in policy development, and also the M&E people really need to be involved with designing the dashboards. Otherwise, we will have dashboards with so much information that instead of becoming helpful, you end up getting confused with and does not make any impact. So getting the people responsible for developing of your annual reports, your strategic, your sector plans, involved with the designing of the indicators that are specific or needs to go on a dashboard is also very important. Instead of waiting on the health information people who are trying to gather the data, because if we don't have the data, then the dashboards also don't look pretty, or most importantly, are not helpful and informative. Thank you.
Thank you, Lenara. And I think we can do a quick look through the comments as well. I can see from Philippa Pretty that she said there's also support from the Pacific Health Information Support Hub based in the Australian Institute for Health and Welfare, not the warehouse. You can contact them at fish@aihw.gov.au, and this is about implementation projects that we were talking about before. Can also see a few comments from Cheyenne. Sorry if I'm not pronouncing your name correctly, about the digital system being used to enter data and expose errors, and allowing that to be presented to the ministers. And yes, just as Lenara and Alex have said, this is exactly what we want digital systems for, to be able to record data, but we do need to get people entering it correctly in the first place to get there. So thank you, Shan. And I think we're getting nearly to time, so I do have one last question for both of you. We're ending on a forward-looking note. I'd love to know, where do you see digital health in the Pacific in 10 years? What excites you? Well, what concerns you first, and then what excites you? We'll start with Alex.
I think in 10 years, for us here in PG, I see a Pacific, where the supply chain is fully automated and nearly invisible. So that's what we that's what we want and what we are trying to do. So the current daily struggles that we encounter, dealing with 50 million in outstanding items, will be a thing of the past. That we will have systems that use AI, machine learning, to actually forecast demand based on real-time consumption data, and also outbreak patterns. And we will one system that will automatically place POs when stock hits a predefined level. Provide integrated real-time dashboards accessible by every level of the Ministry of Health here in Fiji. So this level of efficiency means that the time that we are currently spending chasing delayed orders and fixing data errors will be spent on strategic planning, ensuring that every cent which is not enough is actually used effectively to prevent stockouts and support the doctors and nurses on the front line. And that's the main goal for us here, is the patient and supporting the doctors and the nurses. They are the ones doing the hard job. We are the ones supporting from the back. Yes, so that's all from me.
Wonderful. And I'll pass to Lenara. So same question for you. Where do you see digital health in the Pacific in 10 years? What excites you?
I also wanted to comment that recently we've seen a growth in the development of digital health tools and also with the developments of dashboards and health information here in the Pacific. But one of the things that I see is still a challenge is having to train people and then they leave, or even if it's a doctor or nurse training people on health information and digital health tools and then they leave. So we are still training people that are about to leave the service. Most of the universities here in our region do not offer courses on health information or also do not provide opportunities for training specifically on health information or digital health. Like even here in Samoa, we just recently recognized having data officers, placing them in the district health facilities. So one of the challenge, and I think will be is a challenge I want to pose, is being able to offer health information related courses, even if it's a computing course with one semester of a health information course, just to get them familiar with what the importance of data quality and health information. By the time they get into the workforce, we already have recognized the importance of those sort of trainings, and we don't need to train them again on data quality and data entry in those. So I think that's one of the things that I think is very important to address. And then by having a good supply of people coming out of university with that knowledge, we will have a better supply, knowing that if they leave the service, there'll be new health information knowledgeable people coming out of university. Or else in the next 10 years, the systems will continue to evolve and become even more sophisticated, but we will still come across the issues of people leaving the workforce, not being able to sustain system developments and every new system that comes on board. I think that's my view on that. Also now with the implementation and onboarding of artificial intelligence, we really need people to be very digital literate. And though that's not health specific, it's very important that they are taught these ethics while they are in university, getting ready to come into the workforce.
Thank you, Lenara. And thank you both for the wonderful insights you've given us today. I think we've seen a few threads come up. There's a strong focus on how important relationships are in the Pacific, and you've both talked about having top-down leadership as well as making sure that the whole team comes along and are engaged from the start and can both see why what they're doing matters to the overall picture and how they can be involved. And Lenara, you've talked about making sure no one's left behind in a digital transformation. And Alex, you've shown us different ways that you can do that. I think you've both brought such great perspectives, and I'm very, I do want to thank you, Lenara and Alex, for sharing not just the successes you've had, but the difficulties you've faced and how you've overcome it. This honest discussion has been so valuable. So thank you again. And I also want to thank our lovely audience for being here with us. Thank you all for joining us today. It's been great, and we've had some really great conversation in the comments. Really appreciated. So I think we can wrap up for today, but thank you all for joining again.